So let me read this with you. If you want, you can put your likely answer in the chat. So this is again 58-year-old after MI. So when they specify, what has happened, I really like these questions. It makes things a little easy. Okay, unlike some of the comp questions, which are perceived to be pretty vague, and they are in a way. Anyway, so after MI becomes acutely hypotensive. Look at the words. Please note the word acutely hypotensive. So this has happened all of a sudden after MI. Tachycardic, muffled heart sound. So if you are good at mnemonics, I think your brain should have figured out what this is. Hypotension, increased heart rate, muffled heart sounds. Do you remember something from physio and pathophysio cardiovascular topic? So with JVP distension, okay, they've given us the entire thing here. So do you remember what this is? We start talking about this triad. You remember in physiology. So lungs are clear. What is the best explanation for his clinical findings? Okay, so I've already given you, the hint here, the big hint. Okay, let's see who has. Okay, so very good. Yes, so you figured it out. So this is the Beck's triad. Very good. Okay, so why would this have happened? Now this is very good. Yes, so cardiac tamponade. But what they've asked us is what led to it. Okay, very important. So two things: you identified it, and they've told you it has happened after MI, and then asked you what led to. I mean, like what led to it? Of course, MI, but MI did something which led to this cardiac tamponade. Okay, so correct answer is free wall rupture. So we have a lot of options here: left ventricular free wall rupture, mitral valve rupture, papillary muscle infarction, aortic dissection, septal infarct with VSD. But this is the most likely correct answer would be left ventricular free wall rupture. Why do I say that? Because in this scenario, what has happened is free wall rupture means like the blood is leaking out from the heart. Because of MI, the muscle is dead, there is dead cells, in the wall, there is free space. Okay, all the cells are lost there acutely. Blood moved out from, okay, left ventricle and collected around the heart. You have the pericardium, right, covering the heart, and fibrous tissue around the heart. So blood pools around the heart. What would that do to the heart? It will sort of compress the heart, isn't it? So that is what leads to these features of cardiac tamponade. So hypotension, jugular venous distension. So this is JVD. JVP is jugular venous pulse, and JVD is distension. D is distension, right? Muffled heart sound. So of course you figured this out, the Beck's triad. I have this screenshot from your first aid textbook here. Again, 2 or 3 questions recently asked. So this is compression of heart by fluid in our patient. This was the fluid was the blood, okay, and that has reduced the cardiac output. Okay, another feature, equilibration of. So equilibration is equalization of pressures in all cardiac chambers. Okay, usually it's different, but now because of the pressure, it's like a global pressure all around the heart. It's pressing the heart. It equalizes the pressure. It becomes similar in all the chambers of the heart. Okay, now you see this picture of the EKG here. Okay, and they've drawn these arrows here. What is this? Very interesting. You learn this in your physiology. Okay, so or we can do an EKG sort of class another day. We can get into detail, but I would like to talk about this in very short. This is called electrical alternance. I've put this word here, electrical alternance. So electrical alteration, you can say this word is derived from alteration, okay, or alternating QR. You see this description? Alternating. So that is electrical alternance in the because of alternating QRS amplitude. So this is the QRS, right? QRS. You see the length or the amplitude is basically changing. You see this? What has happened here? Okay. So now don't confuse this as some electrical dysfunction in the heart. It would happen, of course. I'm not saying heart sort of cannot undergo any arrhythmias. Definitely it can, but in this case, this electrical alternance is because now heart is in fluid. There is fluid or blood around the heart, right? So heart, the entire thing is suspended in fluid. Can you imagine? Okay, so this is an abnormal movement of the heart. It's like a swinging movement of the heart. Heart is moving in fluid. So this is something that you see in EKG because of physical movement of the heart. This is not something electrical happening within the heart, which is picked up by EKG. This is just physical movement of the heart. That is why this QRS is changing amplitude. We call it electrical alternance. And in our question, in our patient, what is the heart suspended in? Blood. Where did it come from? Leaked out from the left ventricle after MI. I hope this makes sense. Okay, and you can please learn this. This is one page in your first aid. Please learn this topic, which is very important both for physio and pathology questions. Okay.